Hello and welcome back to our channel. Today we're discussing a very important topic for nursing students and healthcare professionals: puerperal sepsis, also known as postpartum infection. What is puerperal sepsis? Puerperal sepsis is a serious bacterial infection of the female genital tract that occurs after childbirth. It usually happens within 42 days, 6 weeks after delivery. Definition: puerperal sepsis is defined as an infection of the genital tract occurring at any time between the rupture of membranes or labor and the 42nd day postpartum, in which two or more of the following are present: fever, pelvic pain, abnormal vaginal discharge, delay in uterine involution. Causes of puerperal sepsis. Let's look at the causes of puerperal sepsis. 1. Unhygienic delivery practices. 2. Prolonged labor. 3. Retained placenta or products of conception. 4. Frequent or unsterile vaginal examinations. 5. Premature rupture of membranes. 6. Poor maternal nutrition and anemia. 7. Lack of proper postnatal care. Causative organisms. The infection is caused by bacteria, including Streptococcus pyogenes group A, Streptococcus, Staphylococcus aureus, Escherichia coli, E. coli, Clostridium tetani, in rare cases, anaerobic bacteria like bacteroids. Signs and symptoms. Common signs and symptoms include 1. High fever, more than 100.4 degrees Fahrenheit or 38 degrees Celsius. 2. Foul-smelling vaginal discharge, lochia. 3. Lower abdominal or pelvic pain. 4. Chills and rigors. 5. Rapid pulse rate, tachycardia. 6. Uterine tenderness. 7. General weakness or malaise. Diagnosis. Diagnosis involves both clinical evaluation and laboratory tests. Complete blood count, CBC. Raised white blood cells. Blood culture to identify the organism. Vaginal or endometrial swab culture. Urine test to rule out urinary tract infection. Ultrasound to check for retained products of conception. Medical management. Treatment of puerperal sepsis must begin immediately. The following steps are taken. Hospital admission. For broad-spectrum antibiotics, e.g., ceftriaxone plus metronidazole. Intravenous fluids to manage dehydration. Analgesics for pain relief. Removal of retained placental fragments, if necessary. Surgical drainage if abscess is present. Nursing management. Nurses play a vital role in managing puerperal sepsis. Responsibilities include monitoring vital signs frequently, administering prescribed medications and fluids, maintaining hygiene and aseptic techniques, monitoring lochia, amount, color, and smell, encouraging oral fluids and nutritional intake, providing emotional support, educating the mother on proper perineal care. Prevention. Puerperal sepsis can be prevented by ensuring clean and safe delivery practices, use of sterile instruments, limited and hygienic vaginal examinations, timely treatment of infections during pregnancy, postpartum hygiene education for mothers, early identification and treatment of anemia. Puerperal sepsis is a preventable but life-threatening condition. With early diagnosis, timely treatment, and proper nursing care, maternal mortality can be greatly reduced. If you found this video helpful, please like, share, and subscribe to our channel. Press the bell icon for more nursing lectures and updates. Stay informed, stay safe, keep learning with us.